At the South London and Maudsley, we're able to offer a range of services that fit the needs of people with eating disorder, because the range of needs is quite broad. So we have some people with anorexia nervosa, a few, who are so poorly and starved that they do need inpatient care. But the majority of people are able to benefit from outpatient treatment. And some of that outpatient treatment we are able to minimise with the use of new technologies, which the individual then can learn from and put into practice themselves. If somebody's referred for treatment for eating disorder to the South London and Maudsley, there's initially a screening to see what sort of service. So if the signs are of high risk and that inpatient might need to be considered, then perhaps the assessment would be on the ward so that the individual and their family could see the ward environment and meet the staff. However, if there wasn't signs of high risk, they would be assessed in outpatients. And usually that's an individual assessment and inviting family members to come if possible. Admission for inpatient would involve the goal of trying to improve health. And that involves having supported eating and also having various types of therapy looking to help work and social adjustment, to help psychological adjustment and to help relationships with the family, because all of those get disturbed by starvation. Outpatient services usually will involve an assessment, and then people would be given an evidence-based treatment. In some cases, that involves using new technologies such as computerized treatment or vodcast to supplement, so to be giving help in between the therapy sessions, which are usually about every week. And we know that the effectiveness of treatment obviously depends on what the individual brings to it. So some people do have a large number of factors that make treatment more difficult. One thing we know that makes recovery more difficult if people have had the illness for a long time and not had help, because the longer the illness has been present, especially for anorexia, the harder it is to reverse. So early intervention is our goal, and that requires society and families being alert and aware about these problems and trying to help the individual get timely care.